Good morning, students. So, in the last lecture, we have started the subject that is extraordinary vessels, which are 18 numbers. We have already seen the Ren Mai and Du Mai, two that is frontal construction vessel, and backside central that is governing vessel. Now, today we will see the third extraordinary vessel, which is called as Chong Mai. So what is meant by Chong Mai? So I will share my screen. See, Chong Mai is the third extraordinary vessel which is formed during the embryological development in the womb. First, we have seen the first when the fertilization takes place and the two-celled structure of the zygote is formed first, and the second, these both Ren and Du Mai are formed, and to connect them, this is the third vessel. Chong Mai is formed in the embryological development. Now it is also called as thoroughfare vessel or penetrating vessel. Okay, and it don't have any its own pathway. It is dependent on the other channels points. So it is not having its independent pathway. It is connected with the kidney channel, especially kidney meridian, and its origin is in the bow. Bow means just the space between both the kidneys, which is actually arise from that the space. And how this is formed in the embryological development, we have seen that the primal yin and primal yang both combine to form this both Ren and Du Mai, and interaction of these both primal yin and primal yang forms this third pathway, that is Chong Mai. Chong Mai, its meridian. Then what is its function? Especially, it gives the structure, proper physical body to the living being in the womb. Then it is also called as the Sea of 12 channels or the Sea of the Yin and Yang. Why it is called as Sea of 12 channels? Because all the organs inside the body, which we have seen already, 12 meridians, those all the yin, Zhang and Fu organs, yin and yang organs, are dependent. Their function is dependent on the qi or the Zhu or blood, so that whole blood is supplied by this Chong Mai vessel. That's why it is also called as the Sea of Yin and Yang or Sea of Zhu, the Sea of blood. It supplies the Zhu, and especially in the woman, to the uterine blood, that is menstrual cycle is coming and going, because in a proper rhythm, because of this Chong Mai vessel's health. It is under control of this Chong Mai that the proper 28 or 29 or 30 days cycle in a particular woman, or the quantity of the blood or the quality of the blood, and it's a proper rhythm, and the length of that cycle, menstrual cycle, is depend on the health of this Chong Mai vessel. Okay, then women's and men's body hair is also dependent on this Chong Mai vessel. Like, it's a Chong Mai, we will see later, it's a pathway where it starts from and where it goes on the body. So along its a pathway, there is specifically what happens in the woman, its character is descending. It descends the key for the menstrual cycle especially, and the Zhu, the movement of the Zhu towards the uterus. That's why the woman don't have the hair on that particular part of the body. But in the case of men, because its course is along the central area of this, and it spreads over this side on the chin and this on the beard. That's why the male are having the body hairs on that pathway, particular on the Chong Mai pathway. We'll see it later. What its function is, it integrates the pre and post heavenly key. How it integrates? Pre-heavenly key is from, we have seen, that is called as the essence or zinc, which is from the kidney, which is stored in the kidney. So, and the post-haven key is formed by the food what we are eating, which is by the stomach. So it connects the kidney channel to the stomach channel. That's why it is called as a pre and post heavenly key is connecting with the with this Chong Mai vessel. Okay, then what is its function? Then it spreads the Wei key in the chest and abdomen. Like it gives the defense mechanism, because in the course of this Chong Mai vessel, it spreads all over the chest and abdomen. That's why it gives the protection to the entry of the external pathogenic factors. It is depend on the Chong Mai's health. We can see it's a course now on the diagram. It's a pathway, we will see. It has two separate branches which begin from the bow. Bow means the space in between the two kidneys on the back side. It starts from, it's a source is inside the body there. Then it begins at the first, it descends downwards and goes to the perineum, and where it comes out of the body at the acupuncture point REN1. We have seen the CV1 point. Then one branch which ascends from the REN1 and it comes at the acupuncture point, that is ST30 in the inguinal area, ST30, especially at the level of the pubic bone, and where it divides into two branches now. Now, one branch which goes downward from the medial aspect of the leg to the medial malleolus, and where it again divides into two branches. One branch goes to the liver 3 point, we have already seen, which is in between the first and second metatarsal bone, just 1.5 kun proximal to the web margin of first and second toe. Okay, that is liver 3. It goes one branch, and the second branch goes to the kidney 1, just center of the foot, medial and the upper and lower 2/3 and upper 1/3, that center of the foot, kidney 1. Then the second branch from the ST30. Now second branch goes up, which is first goes to the medially towards kidney 11. Where is kidney 11? It is a half kun just lateral to the midline, central midline, just above the pubic bone, superior bone of the pubis symphysis. And it goes upside along the central line up to the kidney 12, kidney 13, kidney 14, and kidney 15. Up to kidney 15 it reaches. Then it goes slight medially and meets to REN7 point below the umbilicus. It's a 1 kun below the umbilicus. Then again it returns and joins to the kidney channel and ascends up through the kidney channel up to kidney 21 number point. Okay, which is just below to the just level at the sternal angle. Then it spreads out across the chest and the chest, over the chest, and then throat, then mouth, and then eyes. And the second branch, where at the brow, in between the two kidneys, the second branch descends downwards, comes at the perineum at REN1 point, and it goes posteriorly to the DO1 point and ascends up through the and goes up through the spine. So these are the two branches of this Chong Mai vessel. Now organ connections. What is the kidneys and bow? The in between the space of the kidneys, that bow and kidneys are connected with the this Chong Mai vessel. Then point categories. Its opening point is SP4. Its a partner opening point is pericardium 6, and its a source point is REN1 from where it comes out on the surface of the body. Then meeting points with other channels. Where it meets, we have seen REN1, it's a first DO-Mai and REN-Mai and DO-Mai, DO1. Then REN7, where it connects again to the REN-Mai, and kidney channel, kidney 11, 12, 13, 14, 15, 16, 17 up to 21 points. Then ST30, the stomach channel, where it divides into two branches, and we have seen the 11 to 21 kidney channel points. Then area of usage, where it is used. It regulates the Qi and Zhu, the blood. That's why it is called as the C of the 12 channels and the C of the Zhu. It is especially used in all the gynecological disorders, okay, like amenorrhea, menorrhagia, metrorrhagia, or oligomenorrhea, like, or vaginal discharges or anything like. And especially we can use liver 3 and with liver 3 point with sp4 point. Okay, it calms and regulates the rebellious key. It treats the rebellious keys of the abdomen and chest. We have seen on the its course, it gives the protection, or the way key is spread out. That's why it gives the protection from the external pathogenic factor. In cases of running piglet key syndrome or like that, it's a sensation, bubbling sensation, feeling. Okay, so it can be gone by treating this Chong Mai. Then it causes the downward movement of the key. In the pregnancy, what happens when lady becomes pregnant, it's a normal function of the Chong Mai is to go, supply the blood proper to the uterine. It's a downward movement of the key. But what happens sometime, because of the pregnancy, during the pregnancy, it's key and its function is opposite sometimes. That's why lady is feeling the nausea and vomiting type of sensation during the pregnancy. Then Chong Mai also controls and moves the zoo. We have already seen. And it is a special function of this Chong Mai meridian, that transformation of zinc to Tian Gui and menstrual blood. In the Tian Gui is which is called as the heavenly water. That is, in male, the semen or the sperm production, and in the female, the menstrual blood production. It transforms this zinc to the Tian Gui. And also treats the heart zoo, because heart transports all the blood system is under control of the heart. That's why heart's functions is also controlled by this Chong Mai, especially related to blood. Treatment of gynecological disorders, all we have already seen, all oligomenorrhea, amenorrhea, like all the things. Especially the menstrual pain which radiates to the lumbar region, to the thighs, which is caused due to the stagnation of the key or the zoo in the Chong Mai. Then treatment of the heart problems, we have already seen. The Chong Mai also treats and governs the blood, which is encircles, because while going in its course to the chest, it encircles to the heart region also, and spreads out all over the chest. That's why the heart problems are also treated with this. Then treatment of weak or underdeveloped muscles in the legs, as its one branch goes down from medial aspect of the leg up to the medial malleolus. That's why all the muscles along its pathway, which maybe any disorders of the muscles, weakness or atrophy of the muscles, can be very nicely treated with the help of this Chong Mai. It nourishes, all the muscles can be nourished. Then now we will go to the Dai Mai. Dai Mai vessels is the horizontal vessel. Dai Mai is called as the Girdle Vessel or belt vessel. It is just like a belt around the waist. It is only the horizontal meridian in whole body, otherwise, or laterally. Otherwise, all we have seen, the 12 meridians or all extraordinary meridians pathways are vertical. They are vertically flowing on the body, but this is the horizontally or laterally flowing. This is Girdle Vessel. This is also the fourth extraordinary vessel in all the 8 vessels in the developmental stage of the fertilization, after fertilization, in the embryological development. We have seen the third one is Chong Mai, the fourth one is this Dai Mai. It integrates the yin and yang. Means, see now, this Dai Mai integrates all the yang vessels and yin vessels which are coming from out and going to out on the foot and channels, all the 6 regular foot channels. So it integrates all these channels, just like a Du Mai and Ren Mai also. Then it has a close relationship with the liver and gallbladder meridians. And when this belt vessel is sometimes, it's a tight, suppose we wear the tight belt, then it's too tight. Then there is we can see the temperature difference in between the lower extremities and the upper body. Just like at the same time, if it becomes loose, this girdle vessel becomes loose, then different organ prolapse may happen. There's muscle atrophy or hernias may happen, spontaneous abortion may happen. That's why the health of this Dai Mai is also very important. It is also described as a gutter for dampness or damp it. See, the humidity which is inside the body can be drained out downwards to the vaginal discharges or urinary dysfunctions through this Girdle Vessel or this Dai Mai. We have seen this urinary dysfunctions is urinary tract infection, which is called as a humid heat in the urinary bladder. Now we will see its pathway. See, its source point is liver 13. Now, liver 13, we have seen this point, liver 13. It is a source point, and from this liver 13 point, it goes diagonally downwards and medially towards the GB 26 number point. Where is it? Where it is located at 26 number point? It is just the anterior and inferior part, or the tip of the 11th floating rib of floating rib. Okay, then it goes again slightly medially to the tip of the 12th floating rib, that is GB 27, and just one kun medially or proximal to GB 27 is GB 28. Now from GB 28 on the right side, suppose it crosses the midline and goes and connects to the GB 28 of the opposite side. Okay, then it goes again same side, like from right, like that of right side, same 27, then GB 27, the 12th floating rib tip, then GB 26, again it reaches to the liver 13 on the opposite side, and from where it is again continuously goes around the side of the body, laterally crosses the back, midline of the back, crosses the spine, and returning to its source point again to the liver 13 on the right side, suppose. So this like this, it's seen in the diagram, we can see. This is the course. Now point categories. Its opening point is GB 41. Its partner opening point is triple warmer. The triple warmer 5. Source point is liver 13, from where it starts. Then meeting point with other channels, where it meets to the liver channel, liver 13, to the gallbladder channel, gallbladder 26, gallbladder 27, gallbladder 28. Okay, then area of usage. The belt can too tight or too slack. We have already seen the symptoms of that the temperature difference in between the lower extremities and upper body. If it is too tight, and if it is too the slack, then the hernias or the different organ can be atrophied. Then Dai Mai regulates the circulation of qi in the legs. It regulates the circulation of the qi in the lower extremities, especially from where it starts. Now it encircles the flow through all the channels to and from the legs. It is connecting from the upper body to the lower body. That's why it influences the circulation of qi in the legs. That's why all the muscle disorders are there. If suppose dystrophy, dysfunctions of or atrophy of the muscles in the legs can be treated with the help of this Dai Mai also. And the temperature difference, which we already have seen. Treatment of imbalances in the hip and waist area. Yes, the same thing. Pain, discomfort, and distension along the pathway of this meridian. Then treatment of dampness and heat along the hip and all where. Treatment of dampness and damp heat in the lower GI, especially the urinary dysfunctions like urinary infection, urinary tract infection, which is called as a humid heat in the urinary bladder, that is a damp heat, or vaginal discharges can be treated with the help of this Dai Mai. Then Dai Mai harmonizes the liver and gallbladder, because its source point is liver 13 and opening point is gallbladder 41. So all the qi imbalances like liver qi stagnation or damp heat in the liver or gallbladder, means gallstones, everything can be treated with the help of Dai Mai. So this is very short and very fast. We have seen all about the Chong Mai and Dai Mai. So if any questions or anything is there, you can, any query is there, you can ask me or comment in the comment box. Thank you very much, students. Thank you.